want to talk about something that honestly nobody seems willing to say out loud. This is for the nurses, the doctors, psychologists, dietitians, therapists, speech pathologists, and other healthcare professionals who feel completely exhausted inside the healthcare system right now. The ones who know deep down they are meant for more. The ones who feel creatively shut down, emotionally drained, underappreciated, overworked, and confined. The ones who genuinely care about people but are starting to feel disconnected from the reason they entered healthcare in the first place. And if you're feeling this way right now, I need you to know something. You're not crazy, you're not selfish, and you're definitely not alone. Because I'm willing to bet there are thousands of incredibly talented, educated, compassionate healthcare professionals walking around right now feeling this exact same way. And before I say this, I want to be very clear. This is not anti-healthcare or anti-public healthcare. Our public healthcare system in Canada absolutely has an important purpose. We need it, especially for acute care, emergencies, trauma, surgeries, and crisis situations. But the truth is, the public system can only do so much. And I think deep down, many healthcare workers know this. I know I did. I remember being an RN working in public health, sitting in 30-minute appointments with patients, trying my absolute best to help them while handing out outdated information, following rigid guidelines, and operating inside a system that simply didn't allow enough time, personalization, prevention, or deeper support. And over time, that started to eat away at me because I knew people needed more. Not just a medication, not just another rushed appointment, and not just another referral or another wait list. People needed education, prevention, lifestyle support, nutrition support, mental health support, connection, collaboration, advocacy, someone to actually look at them as a whole human being. And honestly, the most heartbreaking part was realizing how many healthcare professionals wanted to provide that level of care, but simply couldn't do it inside the system. And I'm sure many of you listening to this have felt that too. That feeling of wanting to do more for people, but constantly running into limitations. Feeling like your creativity, knowledge, intuition, and lived experience are being boxed in by policies, time restrictions, bureaucracy, or outdated systems. And yet, we've somehow created a culture where healthcare workers are almost feeling guilty for wanting to do more outside of the system. Why? Why are we made to feel selfish for wanting to help people in a different way? Why are we taught that the only safe path is staying inside the system forever? Why are healthcare workers made to feel like wanting autonomy, creativity, flexibility, or a deeper impact somehow means they don't care anymore? Because I don't believe that's true at all. In fact, I think many healthcare professionals leave or start businesses because they care deeply. I think they get tired of watching patients fall through the cracks. They get tired of feeling powerless. I think they get tired of seeing preventable issues become full-blown crises because nobody had the time or resources to support them earlier. And honestly, this became deeply personal for me, not only through patients I cared for over the years, but through my own family too. Watching my sister go through cancer, watching family members struggle with mental health challenges, watching people I loved fall through the cracks of a system that simply didn't have the time, support, or resources they truly needed. And over time, I started to realize something. I didn't want to work inside the system. I wanted to help people more deeply and help keep them out of the system whenever possible. And that's what led me down a completely different path. Back in 2010, I became deeply passionate about nutrition, prevention, and lifestyle medicine, so I became certified in holistic nutrition. Then, because of my experience in corporate health and wellness, I started a corporate wellness business. In 2012, I started a healthy lunch delivery program because I wanted to make healthy living more accessible and realistic for busy people. And after that, I moved into one-on-one health coaching for women who were struggling with migraines, burnout, chronic symptoms, stress, and health issues that they felt the system wasn't fully helping them solve. Women who felt dismissed, women who knew something was wrong but weren't getting answers, women who were desperate to feel better. Because again, I could see there was more support people needed outside of what the system was able to provide. One of the most eye-opening experiences for me was working at both the Pediatric Center for Weight and Health and the Adult Bariatric Specialty Clinic. What deeply impacted me was realizing how much emotional trauma, psychological pain, and suffering existed underneath what people were seeing on the outside. And honestly, it was heartbreaking because I could clearly see that the help many of these people truly needed to address the root cause simply wasn't available for them. Instead, they were being placed into a system focused mainly on managing the symptom. And again, it reinforced what I had already been feeling for years. There was more I wanted to do for people outside the limitations of the system. And then eventually in 2022, I entered the beauty industry. And I know this might sound completely unrelated, but honestly, it wasn't. Because for me, it was never just about the beauty procedures. It was about helping women feel good about themselves again. It was about creating a safe environment, a comfortable environment, a place where women could sit down, slow down, open up, talk, cry, laugh, vent, and actually feel seen. Some of the most meaningful conversations I've ever had with women happened while doing the treatment. And that's when I realized something really important. Impact does not only happen inside hospitals, clinics, or traditional healthcare settings. Sometimes impact happens through connection, through conversations, through confidence, education, through creating spaces where people finally feel safe enough to be honest about what they're going through. And those experiences made me realize that I was able to help people in a much deeper way when I was allowed to bring all of my creativity, knowledge, compassion, and life experience into what I was doing, instead of only operating inside the limits of a system. And honestly, that's a huge part of why I created the Just Start method. Because while building all of these businesses, I spent years overwhelmed, stressed, confused, and trying to figure everything out completely on my own. I wasted so much time overthinking, so much money doing things the hard way, and so much energy believing starting a business had to mean risking your entire career. But now I know that's not true. You do not need to quit your job tomorrow. You do not need to risk your entire life. And you do not need thousands and thousands of dollars to begin exploring something. You simply need the right steps. Because I truly believe there are healthcare professionals walking around right now with gifts, knowledge, experience, and ideas that could genuinely change lives beyond what the system currently allows them to do. And I want you to know you don't have to continue doing the exact same thing forever just because that's what you were trained to do. There are so many different ways to help people. And sometimes the ways you're meant to help others ends up looking completely different than you originally imagined. I never would have imagined years ago that meaningful conversations inside a beauty studio would become one of the ways I helped women feel safe, seen, confident, and supportive. But that's exactly what happened. Because no matter what industry you move into, when helping people is your foundation, it tends to follow you everywhere. So if you've been feeling that pull lately, that quiet feeling that you're meant for more, I want you to stop ignoring it. Because maybe the reason you feel confined isn't because something is wrong with you. Maybe it's because your gifts were never meant to stay trapped inside one system forever. And if this video resonated with you in any way, I just want you to know I see you, I hear you, and I understand that feeling more than you know. You do not have to have everything figured out right now. You do not need a perfect plan. And you definitely do not need to risk your entire life or career overnight. Sometimes the first step is simply allowing yourself to admit that you want something more. And if you ever want to chat about it, I genuinely love to hear your story. I offer complimentary 30-minute calls for healthcare professionals and women who feel stuck between the life they have and the life they know they're capable of creating. No pressure, no hard sales, just a conversation. And if you're new here, feel free to like, subscribe, and follow along as I continue sharing honest conversations about healthcare, burnout, entrepreneurship, purpose, and what it really looks like to just start.